Hello, everyone. My name is Marty Guthmiller, and today we're on February 1st, 2021. We're bringing you the 91st COVID-19 community briefing. We'll just jump right in on this February 1st with the local scoreboard. And all of our numbers today, quite frankly, are very good. And so it's nice to be able to bring you good numbers. So first of all, we have 1,780 positives out of 8,951 tests. Not again that's that important of a stat, but we have finally broken under the 20% category at 19.9. So that is a good thing. What's more important though is that for the week, we've had 15 positives. Now we wish that were 0, but that's 15 out of the 212 tests that we did, which is a 7% rate, a very good rate. In fact, that 7% rate is now 2 weeks running. So last week was 7%, the week before that was 7%. So very good numbers there locally. In terms of Sioux County, again, good numbers again. 14-day average is 8.2%. I'm going to give you the last 3 weeks in order that they occurred so that you get an understanding. 3 weeks ago, 18%. 2 weeks ago, 14.3. A week ago, 10.1. And today, 8.2. So very nice, steady decline there. The 7-day average is even better, 5.3%. And again, I'll do the same thing. 3 weeks ago, 12.5. 2 weeks ago, 8.5. Last week, 7.2. This week then, 5.3. Steady decline again. The percent of individuals per 100,000 population, I'm sorry, I always do that. Not the percent, the number of positives per 100,000 population over the last 7 days is 91.7. And I'll compare that number to the state in just a moment, but that is a 91% decrease over where we were the previous 7 days. So 91.7. I'll just jump to the state number right away in reference to that. The state number of positive individuals per 100,000 population over the last 7 days was 177.9. And that number has only gone down 0.8% over the last 7-day period. So Sioux County at 91 is about half of the state rate when you extrapolate the number of positives, individual positives over the population. Finally, going back to Sioux County then, the number of individuals, we had 33 additional individuals in Sioux County test positive this past week. Again, that's only as good as how it's referenced to previous weeks. So I'm going to do, again, the same thing, 3 to 1 week ago. 3 weeks ago, that number was 102. 2 weeks ago, that number was 65. 1 week ago, that number was 59, and today it's 33. So again, a very steady decline in the number of positives that we've had in Sioux County. Region 3, the 20 counties in Northwest Iowa, we've had 32 hospitalizations currently in Region 3 with COVID as a primary diagnosis. That is down from 50 a week ago. 76 2 weeks ago, 91 3 weeks ago, same kind of stair step. But we still have some sick people. Of those 32, we have 8 people in the ICU, and of more consequence probably is that 5 of those 8 are on ventilators. So still some serious situations out there. I went back and looked at the rolling averages of Region 3, and basically we're at some of the lowest levels since the beginning of the pandemic. Probably more recently, last July, August kind of time frame is where we're at in Region 3 currently. State of Iowa, 14-day average, 9.9%. So that's the first time that we've given that number less than double digits. 3 weeks ago, 14.6. 2 weeks ago, 12.9. 1 week ago, 11.0, and now 9.9. 7-day average, 7.5%. 3 weeks ago, 11.8. 2 weeks ago, 9.2. Last week, 8.5. And again, 7.5 today. I did mention the positive individuals per 100,000 population at 177.9, staying fairly steady at a state number. The number of hospitalizations in the state of Iowa, with Iowa residents hospitalized somewhere, continues to drop as well. That number is 358. 5 weeks ago, 3 weeks ago, 541. 2 weeks ago, 483. Last week, 382, and now 358. All the numbers are sequencing down, staircasing down, however you want to say that, in a very consistent way, and in a very good way. We've had a number of these reports in the past where they were staircasing up, and it's really good to bring you these numbers at this stage of the game. Sioux County has 2 residents hospitalized, and that has not changed since last week. Again, one of the things to keep this real, and this is not over, is the number of deaths. Again, I'll be honest with you today, I don't know what the stats are telling me, because the number that they're giving me is 4,906. And if you agree with that number, or you agree with last week's number, that would show and document that we've had 418 deaths this week in Iowa, which would be significantly larger than where we've been at. So I don't know. I went back, checked my numbers. Sometimes the state changes how those numbers are calculated. I don't know if this is the case. I wouldn't worry about that number too much. I did go back and look at the graph that shows the rolling 14-day average. We've been on a steady decline for quite some time, for several months now, and we're at probably the lowest level that we've been at, again, since last June, July, in that time frame, and almost, you could argue, back to the inception of the pandemic, some of the lowest death levels ever. So I don't know how that reconciles with the 4,906 number, and I would tend to believe the graph, and there maybe was some catch up in the 4,906 number too. I don't know, but in any regard, we're at some of the lowest numbers that we've been in the pandemic. The statistics are not really changing. 94% of the deaths are still in the demographic of 60 and over, and there are still 0% deaths under the age of 30. So those are the stats for this week. Again, very, very good. If we continue these stats, maybe we won't reach the 100th briefing at this point. But again, it's very good to bring those numbers to you. I want to give you a couple updates on Orange City specific things, and particularly starting with the nursing home, because there's some good stories happening at the nursing home. The first one is at Prairie Ridge and Landsmere Ridge Assisted Living. There's roughly 200 tenants, residents, and staff that have been vaccinated and have actually received the second dose as well. So that's about 400 doses that have been administered in our nursing home environment and in the assisted living environment, and that's through the Walgreens Pfizer combination. We do have approximately 30 folks, tenants, residents, staff on February 16 that will receive the second dose, and some of those folks are people that decided to get the vaccine after the original first dose was given, or people that are new, that have moved in post the first dose being given. So in any regard, February 16 will be our last and final experience with the Walgreens model. They've been very good to work with. It's worked just fine. And the best result is the end result, meaning that we'll have over 200 people that are fully vaccinated, with the efficacy fully implemented somewhere in the neighborhood of March 1st. It'll be sooner than that, more like the middle of February for a lot of our folks, but by the end of February for all of our folks. And by the way, after this, after February 16, the nursing home population and staff will be taken care of through our normal Moderna process at this point as it currently stands today. So the Walgreens Pfizer connection will be done after February 16. Just a general note on most nursing homes and when we can expect things to kind of start opening up again. Most nursing homes by March 1 will be in pretty good shape. We can't say that completely, but most should be in pretty good shape. What that means, we're not sure yet, because we can only do what the government allows us to do. And the government in this case, most likely, is the Department of Inspections and Appeals. It could also be CMS. It could be the CDC. It could be Iowa Department of Public Health. We're not exactly sure. We think it'll probably be DIA, but we will be taking guidance from them as we have throughout this process and as we must to follow the rules. So again, just because we're so to speak, bulletproof, we're going to have to be very careful with how we open up, how we bring people back, and how we begin to integrate our nursing home to the world again. But it'll be a good experience to go through. Believe us, at this point, we're very anxious for that. I want to shift a little bit to the clinic vaccination process, which will begin this week. We have about 600 appointments through the month of February at this point. We decided to cut off appointments because we were getting a little too far out there relative to the expected amount of supply that we will get. And so in addition to the 600 appointments, we have about 450 on a wait list. We will continue to accept wait lists additions either via phone call to our clinic or by the internet at ochealthsystem.org. You can fill out a form. Either way works, and hopefully the call volume has definitely calmed down, so you should be able to get through. If not, the internet is there. So both systems we felt are important for our 65 and over crowd to get in. And so the phone system and the internet system will continue at this point. We do expect to give at least 250 vaccinations this week. That is what we're expecting. We feel pretty confident that we're going to be able to do 250 this week. What we can do after that is going to depend on the allocations that we do receive. So we will do more if we get vaccine. Our goal is to have 0 vaccines left at the end of each week. So we want to be good stewards of that. We want to be responsible with that, and we want to get the vaccine given to people as soon as we possibly can. Again, I think this bears repeating too, for those of you concerned about getting the second dose. The state has separate allocations for primary dose and booster dose, as I've discussed in this forum before. So far, the state has come through with that we keep our booster doses separate from our primary doses. And so far that's come through, and we have every reason to believe that it will continue. So one should not be worried about getting the second dose after they get the first dose, because those are kept separate. If that should ever be the case, and by the way, we have about a 2-week grace period with getting that second dose. So it doesn't have to be exactly at 28 days. It could be at 35 days, could even be at 42 days in terms of what we're currently hearing. And we don't want to stretch that, and we want to stay as close to 28 as we can. But just so you know, there is a little flexibility with that. If we ever get beyond our ability to do that in that zone, we will divert primary doses to the booster doses. And so, because that will be a priority because of the time restriction. But again, what we've seen so far is that that is unlikely. But of course, as we all know, in today's environment, the world is not always what it seems. And so we have to be ready to adjust, and we will, again, get those vaccines out absolutely as soon as we can. We do have contingent plans available also, should there be a bolus of supply all of a sudden. We have people staged that we can give these vaccines very quickly, and we will. Again, our goal is to have 0 left at the end of each week, and we want to try to meet that goal. That's going to be it for today. Again, it's a pleasure bringing more positive news today. Things are very quiet in the hospital relative to COVID. That's a good thing. We're beginning to think about how we can loosen things up a little bit. Again, that's not always within our jurisdiction. That the CDC, Iowa Department of Public Health, our governmental regulators are dictating those things to certain degrees. But we are beginning to contemplate what it is that we can do to loosen things up a little bit. Thank you for hanging in there with us through all of this. It's not over. It's clearly not over, but we're on the right trajectory at this point. So continue to stay strong, continue to be vigilant, and we wish you good health. Stay healthy. Thank you again. We look forward to a briefing probably again next week, unless if there's some notice this week that supply increased dramatically or something changes, we'll come back with a special briefing. Otherwise, we'll look for another briefing next week, Monday. Thank you for joining us.